realized that's how I can identify now in terms of a identity or role, amongst other things, of course, in terms of the hat I'm wearing. But that was important to me, that the person said that they saw me as an ally. And I think that goes back all the years, as I go through and think about the various organizations I've been with, both in the AIDS movement and others. But that has stayed with me all the way through, the people I met, obviously, in the communities. So for me, it's about, I think, 1987 was when I first started in Hamilton. And in terms of changes in ASOs, so I'm going to talk about changes in ASOs and then my experience in Guelph and then the long-term survivors again. But in terms of changes, so I started in 1987 on the board of TAN, which at that time was called the Hamilton AIDS Network for Dialogue and Support. So it was called HANDS. And so just one example right there of changes in ASOs, the three organizations I've been with, either as an ED or board member, have all changed their names. In the case of the Hamilton-based ASO, 3 times. So it was HANDS and then the Hamilton AIDS Network for a long time. And it's been the AIDS Network for quite some time, since 2005. And we call it TAN. And then we went into a regional service area in 2005 to 2 as well. So there's another change over the years. And then in Guelph, when I was there in the 90s, late 80s, early 90s, mid 90s, it was ACGWC, of course, AIDS Committee of Guelph and Wellington County. And you've changed your name, and I think your service area has increased too as well, into a regional area. And then I was at, I left Guelph and was at Peel, and that was called FAN, Peel HIV AIDS Network. And they just recently changed their name to Moyo Community Health Services, I believe. So there, right there is a reflection of changes in the ASO movement. But as I go through the years again, when I first started as a board member, there was no staff even in 1987. Funding was just starting from the Ontario Ministry of Health AIDS Bureau, which is still with us today, thankfully, and supporting us in so many ways. And there was just volunteers, and they were amazing volunteers. Many of them were long-term survivors eventually. The first staff that were hired were like support workers, basically, what I remember. And then when I came to Guelph 3 years later, in 1990 on the board, and I moved to Guelph in 87, funding was established now, and there was a staff of 5. And then when I became executive director, it was 5 staff, and it was kind of a model that a lot of ASOs used, and still do to this day, but like it was kind of simple. And I was telling another colleague of mine at TAN about that, like we're kind of remembering the days when it was sort of a lot of programs were grouped together. So there'd be like an executive director, a volunteer coordinator, an education coordinator, a support coordinator, a fundraising coordinator, and it was fairly simple, kind of, but so much work, in each portfolio. Other changes, I'm going to come back to Guelph, but I guess a big change that I noticed in the movement then that I was involved in when I was executive director there was helping to establish anonymous testing, and that was 1990. 92. And that was a very important step, obviously, and something that is now so fairly common, but at the time it was a big deal to get public health, work with public health and help them kind of get that introduced. And then I'll switch over to Peel when I went there later in the 90s. And what stands out there for me is having a meeting with Mayor Hazel McCallion at the time in Mississauga, who said, at that time, there was no gays or no drug users in Mississauga. So I was able to have a meeting with her because we were organizing a community forum on establishing a needle exchange in Peel. And just because I had a connection to her through my family, I was able to get her attention. And I got her thinking around it, because at first she was saying, well, they need treatment. She was really focusing on that. Finally, she agreed that, yes, okay, let's go forward. And so I was very proud that that happened, that there was a community forum to talk about needle exchange. That was 1994. And then, I was away for the movement for a while, but at each point too, before I forget this, whether it was Hamilton, Guelph, or Peel, the importance of people living with HIV and the involvement of the organization and long-term survivors, every step, the community building that we underwent in every community was just amazing. And always remember that, as I was able to witness groups of people coming together and supporting each other, learning, developing leadership skills, getting involved in the organization at all levels. And to see that happen was just remarkable. And I'm very grateful that I had that opportunity to witness that and continue in a lot of ways. So, jumping forward now, when I came back almost 5 years ago as the executive director of the AIDS Network, the changes now are like, we have more staffing, different kinds of positions. The priority population networks, those were not in place when I first started. The spectrum of programming is now quite varied. And now we see other agencies changing names and maybe the range of services and regional services. So there's all those changes happening. And of course, everything now with the opioid crisis, the poison drug supply, and now COVID, it's just so many things happening that we have to respond to change. And I'm feeling very, while feeling uncertain in a lot of ways, very grateful that we have this legacy with us of long-term survivors, partnering with us, working with us, leading us to get through change. And people look towards us as leaders because of that history that they were part of and that we were part of. That helps us, I think, because people look to us for leadership in these times. And I see it now for sure. People approaching us for partnerships, wanting our involvement, our opinions, our help. That's quite satisfying, I think, to see that after many years, to see how valued we are as a community and as a resource in the community. I'll just go back to Guelph. So Guelph is so much love, and I have so much love for Guelph and affection. I lived there for 8 years. I moved there from Hamilton. I just started on the board of Hamilton AIDS Network, and then for Dialogue and Support, HANDS. And then I got to Guelph, and I was immediately asked to join that board by a colleague of mine. I worked at St. Joseph's Hospital as a public relations director. And again, being part of Guelph's growth at that beginning was a really important part. And some of the things I remember, the first walk that we did when that was 1992, I think, or maybe 91. When the quilt came to the armories in Guelph, I don't know if that's what the building is called, if it's still there. That was a huge watershed moment in the community. We had an art auction. I remember that was a wonderful event. And we had Timothy Finley, the author, was there with his partner at the time and spoke at that one. My own personal sort of journey through coming out and through being involved with the queer community in Guelph was really rewarding at that time. It was exciting. We had 3 bars. That was a big deal in the mid-90s at that time. And I remember going on marches. My first Pride March was 92 when I was living in Guelph. And I remember also marching around Queen's Park. We had yellow ribbons and tied them around the legislature for calling for same-sex adoption, I think, couples to adopt. That back then, that was 94. And I remember going to, in the United States, a march on Washington with some folks from Guelph who some are still friends today. That was a huge one to be part of a massive movement in the United States. There was a whole contingent from Guelph that went down for that march. It was 1993, one of the first LGBTQ marches in Washington. I remember at one point along that march, we came across protesters, and to see the face of hate at you was something I'd first experienced. I'd never experienced that before. People yelling at you in rage and saying, die. God hates gays, whatever, and use another word. God hates Canada. It was just unbelievable to see that. And so I witnessed that and experienced that and thought other people experience this all the time, what that must be like. So those were some of the moments, watershed kind of moments, I guess, for me in Guelph, and so much affection. And just, I was thinking before we were, a bunch of us were in the breakout room, and I thought, well, wait till now, tell the story it reminds me of being like what in theater, I think it's called the green room, where people wait, or in television, wait to go on. And when we moved the office, and this is another important step, I think, in Guelph, from where the original location was on Delhi Street, where the Guelph General Hospital is. And we moved it to a house on Woolwich Street. And I'm sure some of you know where that is. I think it was a former dentist's office, and it was a wonderful space. And that really was a beginning of building community for Guelph, with people with HIV and with the whole community around the ASO. Having that house was a great space in a backyard. But there was a little lounge there, it was an older house, and we gave that to, became a support lounge for clients. And then they kind of adopted, it became their room, and there was a green door, I think, or someone named it, one of the clients named it the green door room, or the green room, and they painted the door green, and then they put their names on it. And that was the first time that people kind of were publicly putting their names up, people who had HIV. And we consulted with people first to see if that was okay, and that's what they wanted to do. So we did that. So that was a huge moment, I remember too. And then, things changed obviously, and that door, I don't know what happened to it, but I heard there was a story around that, but I won't go into that. But one of many, many legends that go on in the ASO movement. So for Guelph, yeah, there was so much, what wonderful times, and I'm very proud of where the agency has gone since then. You see the changes, like with clinical services, and we've had the same just recently at 10. And Guelph is just a great community, and so much fondness there. Another big important change for me, I met my partner at the time, who was HIV positive and was a leader too in the movement. He was an executive director in Sudbury, and then Peterborough, and then we moved in together in Guelph. And in those days, I was on the board, I was in ED then. We had a support group, so it was HIV negative partners, and we met in our apartment. So he would go out, and I would host the group, my group for HIV positive, HIV negative partners, and then he would have his group during the day while I was working, HIV positives, because there wasn't enough space at the agency at that time. So that really stands out in my mind too, in terms of community building and long-term survivors. And so, just bringing it full circle now, I'll never forget, just a year or two ago, we have I think about 3 times a year, luncheon at 10 in Hamilton with the clients and the support program. And we chat with them, and we listen to a lot of feedback about programming and what we might change and what they're looking for in the future. And I'll just never forget, one of the longer term survivors, a long-term agency member, just said to me when we were kind of wrapping up, just don't forget about us. And I'll always remember that, and always commit to, I'll never forget everything I can do in my power to make sure the stories continue, that the legacy continues. And as we go through so many changes, that legacy, I think, is a through line for everything we do, and gives us so much strength and resilience together as a community, and to honor those people, to honor people who are long-term survivors and their resilience. That's it for now.
Thank you, Tim. That was very touching, and it's wonderful to get such a broad range, not only of the history of this organization, but also your history with organizations from across this, not just region, but like this center of Ontario. It sounds like it's a broad range of experiences. Thank you. That was Tim McClements, the Executive Director of the AIDS Network in Hamilton. I will now actually reintroduce all of our panelists. Unfortunately, there was a small technical difficulty at the beginning of our talk. In the live version, we are just missing some of the introductory pieces that will all be available when it is posted later in full. But for now, our speakers are Tim McClements, Kelly Timbers, who is a member of ARCH's board of directors and a prominent speaker in the Guelph region about HIV stigma, and Deanna Clatworthy, who is the ARCH clinic coordinator and nurse, and she provides care for people who are not only in this region, Guelph's catchment area being Guelph, Wellington, Dufferin, and Grey Bruce. But she also provides care to people living in Kitchener, Waterloo, Cambridge, and those surrounding areas as well. So I will now hand off the mic over to Deanna to continue. Thank you.
Hi, everyone. Big thank you to Matt, Mindy, Juan, and Sonia for organizing this very important event. And Tim, thank you. I wanted to personally thank you for all the work that you did in the beginning, for you and all the folks who were by your side, because we wouldn't be here today without the work that you did that was so important. I want to let you know that that door is alive and well. It is it's in our boardroom. It is hung up, and we are very proud of that door. Of course, we would love to have it in a museum, but because there are people's full names on there, it would out folks who have left us or who have signed messages with their full names. So we honor that every day, and it is in our boardroom hung proudly. So it didn't go missing.
Thank you. Good to know.
I do want to talk a little bit today about the clinical side of things, because I am a nurse and want to talk to you about some of the changes that I've seen. Certainly the AIDS crisis, when it happened, we all remember the I hope that ding's not showing up. I don't know how to turn off the sound. We remember the uncertainty and the fear. We didn't know how this illness was being transmitted. And I think some of us are living that right now with COVID and experiencing that again, that, you know, how can we keep ourselves safe? People were taking no medications at first. There was no cure, there was no treatment, and we were losing a lot of really wonderful members of our community and didn't have a way to end this. Then we had drugs like AZT come out, and unfortunately some of the drugs that were developed while they were helping to fight the virus, unfortunately were also fighting important organs like your liver and kidneys. And I will never forget the day that a close friend of mine told me that they were HIV positive, and I was very frightened, and I didn't know a lot about HIV at the time. And I asked, you know, I always thought we were going to grow old together, and are you on medications, and how long do you have with the virus? And his answer to me was, well, don't worry about my HIV. HIV is not going to kill me. My drugs will. And that was really hard for me to hear at the time, but he said, you know, the drugs unfortunately will get my kidneys. I'm proud to say that they didn't, and we got newer medications, and he is alive and well. So we moved from having some really toxic drugs to, and people taking handfuls of medications 3 times a day, 4 times a day. Really struggling with pill burden. If you can imagine how difficult that was to swallow handfuls of pills over and over, be reminded of the virus. And when I started on here 10 years ago, we were the AIDS Committee of Guelph, and I started off as a volunteer. And 8 years ago, I took over the position of managing the clinic and being one of the nurses here. And at that time, we had most of our patients were on a combination of at least 3 medications, some more than that, but they were all separate pills. So we were still, and they were taking them usually twice a day. So we were still counseling people on how they could take, you know, 6 to 8 pills a day, and how they could make sure they were adherent. But we were seeing really awful side effects to the medications. There was diarrhea, insomnia, really terrible nightmares, but mostly just feeling incredibly unwell, and they couldn't work. In fact, most people, when they came in, would bring an application for disability, and there was a little tick box that would immediately put them on disability, because HIV was known to be so debilitating. we saw the drugs have some really horrible effects, such as lipodystrophy. So you'll note that some of our long-term survivors may have some wasting of fat in their face and in their limbs, and the meds cause some horrible side effects. I'm thrilled that our companies have continued to work and come up with better medications. Now we have most of our patients on one pill once a day, and that is huge to be able to only have to take one pill. We don't struggle with that pill burden anymore. However, you are reminded on a daily basis that you are HIV positive every time you take that pill, and that can be very difficult. 10 years ago, 8 years ago, when I started running the clinic, one of my jobs as the manager is to report our statistics. How many folks the government wants to know speak English? How many speak this language, that language? And what age groups they're in, and how many appointments we provide, all of those kind of things. And 8 years ago when I started, when the age groups are broken down in the reporting, the one category is age 65 and over. And I was never able to fill out that category. That was always a 0. We didn't have any patients over 65. And I remember very clearly the first reporting period where we had 7 people over 65, and running down the hall to share with the executive director how exciting this was for me, that we were having people live longer and they were doing well on their medications. And every time now that I report that statistics every 6 months, I'm really excited that that number grows. And that for me is a huge deal in my work, because I'm just so excited that folks are living longer and longer and doing well on these medications. Access to medications, unfortunately, is still really a problem. And I don't know how many people realize this, but in Ontario, HIV medications are about $2,000 a month. So if you have a great job that has great benefits, and then you're fine. You can have access to medication. If you are on Ontario disability, you have a drug card and can access medication. But for the average person who has a great job but just doesn't have benefits, there is no coverage for medication. This is not the case all across Canada. So in British Columbia, your medication is paid for. Winnipeg and some of our eastern provinces as well cover the cost of medication. So it's very difficult for me as a nurse when we have someone move here to our catchment area from another province to then explain to them that they need to find $2,000 a month for medications. We do have a fantastic program called Trillium that was actually a program that was developed because of the AIDS crisis to help people access medications. But again, it still is difficult for folks to access medications. So that is still currently a problem that we see. I've seen the changes in legalization around disclosure change. So certainly when I worked here in the beginning, we had patients who were incarcerated, and while they had disclosed their status or have told us they disclosed their status, certainly in the eyes of the law, the person who was accusing was definitely the more reliable source. And now we're seeing less of that. And I remember us in the office celebrating the day that the government came down and the Supreme Court came down with the ruling that in order for disclosure, if you are have a viral load of under 1,500, which that's actually quite amazing because undetectable is under 40. So if your HIV viral load is under 1,500, you are using a condom, and you are taking your medications every day, that you don't have to disclose your status. And that was a huge celebration for us, that the government and the law was finally realizing that we don't need to criminalize folks with HIV. We have some great programs here that I have seen grown over the last few years, particularly our anonymous rapid HIV testing. We have lots of folks in the community who access that, and that certainly is helping to raise awareness. It's helping to catch infections when they are new and get people on treatment right away. I think, again, Tim, you mentioned that we changed our name from ACG to ARCH. I think we're becoming much more well-known in the community. We have great partners. We are known as a local resource for folks who are looking for care or education or support. We have a lot of programming available. I guess I'm seeing now our long-term survivors who are to be celebrated. I think I'm so privileged when I get to meet them and hear their stories of how it was in the beginning and understand how devastating that was. And I'm seeing some of them being triggered right now because of COVID, and they're reliving some of that stigma. And what I hope is going to happen is that the general public is going to understand a little better now of what that stigma feels like, because certainly we heard Tom Hanks say that now people don't want to be around him, and there's a lot of stigma because he had COVID, and hopefully folks like him will speak up and will have other people talk about how awful that stigma felt and how it needs to stop, and how the stigma carries out through HIV and other illnesses. So I think that's what I have to say for today. Thank you so much for letting me be a part of this incredibly important event. And once again, Tim, thank you for your great work in the beginning. It's because of folks like you that we are here today.
Thank you, Deanna, especially for your passion and the celebration that you convey, not only for the decriminalization of HIV, but also for the celebration that people can actually age with HIV now. And that's something that we're constantly talking about right now in the HIV/AIDS sector is, what does it mean to age with HIV? Because it's actually very new for us to be in a space where people living with HIV do grow older. And it's a beautiful thing. And thank you for touching on that. And also for touching on that long-term survivors are not only survivors of HIV itself, they're also survivors of the stigma of HIV, and also survivors of treatment itself. Because the treatments, although now they are getting better, the treatments have not always been great. And that has been part of the struggle and the fight that many people have worked towards to be able to improve the lives of people living with HIV. I'll now bring up our consummate stigma expert, Kelly. And there we are. Kelly, if you'd like to take us away.
Hi, everyone. My name's Kelly. I've lived with HIV for being 19 years, October 25th, 2020. I was a victim of a sexual assault out in Vancouver. And when I was out there, there was a lot of hatred, a lot of stigma and everything like that. And I had lost my mother in 1999. She became AIDS. She was HIV for only very few years. And here I am kicking butt. But I plan on fulfilling her dream and my dream as well. And to continue to fight the stigma, because, you know, it's very important that everybody understands nobody's any different than anybody else. I've always believed in, as long as you're honest with somebody, then it makes it easier for you to go around and be around people. Well, because of the fact that I lived with my mother with HIV and an aunt as well, I wound up learning more about HIV when I was about 13 years old. Lost my aunt when I was 16. My mom couldn't really decide whether she was HIV or not. So she when she was alive, there was not the medication that there is now. Like, it's phenomenal. Like, I've been undetectable for 17 years. I am now down to one pill once a day. I was on different medications, but each time I get put on a medication, it works for me. Like, yes, there are some side effects for some people. Myself, I'm lucky. I did not go through any side effects. Well, maybe gaining some weight, but that's okay. Um, I have to do a little bit of humor here. But with me, living with HIV has opened my eyes and be able to look at life differently and be more to fight this stigma, because there's nothing wrong with us. Just because we are HIV doesn't mean we're any different than the person that's not HIV. We laugh, we joke, we go to the same bathrooms, we eat the same food. So, it's very upsetting to still hear people with the ignorance, the stigma towards it. And ever since I got diagnosed in 2001, I have been one to fight stigma. I have taken it upon myself to learn to speak better. So that's why I'm here today. Not only that, this is my passion, this is my dream, to end stigma. I've been doing this work type deal for the past couple of years, because it is very important to me, and I want to see it where the next person that may wind up with HIV doesn't go and get help or seek help or ask somebody or tell somebody because they feel like they're going to be, crapped on, or where it's not like that. We have all rights to be free in this world as anybody else. And a lot of people need to understand that U equals U means undetectable and transmittable. So for me, I want people to get more of an education and understand that, you can hug us, you can kiss us, you can smoke us a cigarette with us, we can share things and you're not going to get sick. But it does not mean not to still take precautions. For myself, as I said, I've been undetectable for 17 years. And that's been a blessing. I did have Deanna as my nurse all the time. I haven't had the joy of meeting Tim yet. Rashad, I deal with him on a regular basis as well. So for me to have Arch here and all the workshops, the educational things that we can do to and offer help to someone else out there is very important. And I will agree with Tim. Arch has gotten quite a few names. I remember when my mom was alive, we would go down to Quebec Mall upstairs, and it was ACGWC. Is that how it was? Okay, I got it right. Woo. And then once we left Quebec Mall, we wound up at, if I do believe, Willett Street in the old counseling building. And at that point, we were called ACG. And then we gradually moved over to Dawson Road, and that's when we became Arch. And I think it's been very helpful and everything for people out there. Like I said, there is a lot of shame. There is still a lot of, worry that somebody's going to dislike you because you have HIV. No, if you ever feel that way, we're here for people to talk to. And I've told everybody, like, you need to talk. You want somebody to talk to, you want somebody you can confide in, you can message me, because I'm not going to sugarcoat anything. I'm very open and honest about the illness, and it's actually not even an illness. All it is just something that's in your blood, but it's not taking your life. There's times where I should have been dead, because I'm also a recovered crack addict. I've got over 4 years under my belt. So, like, yes, I had a drug problem. Yes, I was using using drugs while I was on HIV, and, but it wasn't until I got situated in amongst Arch, ACG at the time, that I've been able to actually move forward and look forward to life. Like, I was pretty much 2 weeks away from death's door when I first got put on medication that actually worked for me. And here I am, still fighting. I will fight until my last dying breath to end this stigma, because it's got to go. yes, the pandemic's been hard on everybody, and myself, I know how to deal with things differently that help me, and I've been able to for most of my life. I grew up being an only child, so I took on a lot of responsibilities. So those responsibilities helped me become the person that I am today, as well as being able to get up and speak. And, my passion, again, I can't say it enough, is to end this stigma, because it's very important that we do, because there are so many people out there, that need the help, that need someone to listen, that, needs the medication, before it gets worse. Like, we don't need that epidemic to come back from back in the 80s to now. There's so much more to be learned. There's so much medication out there, that can keep you alive, and you can live for 100 years. Like, seriously. So I'm really hoping that, with these long term survivor days continue. I've worked on doing this for over a year. The rest of my folks couldn't be here with me to do this, but I'm very glad that I can get up and speak and share my story, and be able to be there for somebody else that could use someone to talk to. So I want to say thank you to everybody that's sitting here listening, and to know that don't be afraid. It's when you're afraid that things will look down. Um, have your head up, your chin up, and just keep looking forward to life, because there's so much in life you can still do, So don't hesitate to get tested. Don't hesitate to reach out to someone. Don't hesitate to take that medication, because you know what? That medication is going to keep you alive. It is me. And I'm just so grateful for here, and so grateful for the support system that I have had over my years. So yeah, please know that this isn't the only time we're doing this. We're going to have it yearly, and make sure that the stigma goes away. And I, again, will do that until my last breath. So anyways, thank you. And yeah, if any, feel free to ask me anything when it's time. Bye.
Kelly, I just wanted to pop on for a moment and thank you. I think what a lot of people don't realize is most people keep their HIV status to themselves. It is private. It's their little secret that they live with, and they live in fear of anybody finding out. And so for Kelly to live with her status public, and for her to go online in events like this or a public speaking and actually share that she's living with HIV is such a gift. She does great work. I've watched Kelly blossom and just become you were so eloquent today, Kelly. I'm so proud of you.
Thank you, Deanna.
But Kelly's speaking for people who don't have a voice, people who can't even click on here and watch in case their names are seen on here. They'll watch it in secret later. People who come in and say that they can't tell another soul because they're afraid of losing their jobs, of losing their family. And unfortunately, that's a reality. So Kelly speaks for hundreds and hundreds of people in our community who don't have a voice, who cannot actually come out and speak about it publicly. So Kelly, I can't thank you enough for your willingness to share your story, because you're right, it helps people, it helps reduce stigma, and that's exactly what we need. So thank you.
Thank you, Deanna.
Thank you, Deanna, and thank you, Kelly. Thank you for your passion and for sharing this intergenerational story of resilience in a world full of stigma. It's very important, and it does mean a lot to us that you do share this. Thank you. We'll now be moving into our question and answer period. So some questions might be directed to an individual within our ranks, but if something is a little bit more general, then feel free to hop on and let us know that you'd like to field that answer, and we'll pop you onto the main screen. So first question that I'm seeing over here is, why do you and this is to nobody individually, so as a group, why do you personally feel that is important to bring awareness to long-term survivors? The sub-question within it is, why are you personally passionate about HIV work and advocacy? Okay, Kelly, please. Oh, sorry. If we can just get Kelly.
Okay, I got it. Now it was okay. The reason why it's so important for me is because, you know, there's the older generation and newer generation that needs to have awareness and to know the difference between what's right and what's wrong, or what can be done, what can't be done, you know, what support, what not. It's important that we have people to, you know, support us, because it's that support that's going to help us be able to make a difference in this world. And quite frankly, we need a difference, you know. Yes, I get it. A lot of stigma still out there, but you know what? We have to do this. We have to unite and be together on this and make this change, because that change is very important. Because there's going to be another time that there's something else that's going to go on, and it may not be HIV or AIDS, and then there's going to be another one. So let's put this stigma away, and, you know, be able to feel comfortable and free enough, and be able to, you know, live a life without chaos, if that makes any sense. So for me, it's important for me to do so, because there is a lot of people that don't have a voice, and I want to be that voice for everybody, whether it's a good thing or a bad thing. It is my passion. I want to see a difference, and I want everybody else to be able to feel safe and secure, and not be so judged if they wind up with the illness as well.
I see that Deanna is liking to chime in.
Yep. I just want to mention that one of the reasons this is so important is that we need to celebrate the resilience of our folks who, as you mentioned before, Rashad, have lived through some pretty tough times. And so resilience absolutely needs to be noticed. We need to make awareness. We need to celebrate their resilience, but we also need to get the message out to the community. So certainly when our folks used to show up here with a diagnosis of HIV, in the beginning, it was a death sentence. And we were telling people to get their affairs in order. And now we're telling them, you're going to live as long as I am, and or longer. And so it's important that our community understands that people are living with HIV. They're not dying from HIV. They're living with HIV, and they're living a long time, and they are healthy, and they are well, and they are valuable members of our community.
Thank you.
Yeah,
And Tim?
Yeah, sure. Just briefly add to the kind of what I was mentioning before, that, you know, the blessings and gratitude I feel to have the opportunity to work with long-term survivors over the years, working alongside as partners, as leaders, as staff, as volunteers, to see that the change happen within themselves and with their own community, and that resilience that's been mentioned. It's a real honor to be witnessing that and to be part of it. And a couple of things I forgot, just watershed moments. And I know Kelly and Click, I can't see you, talked about this. Deanna, the treatment issues. I remember doing a die-in on, we used to chalk ourselves, lie down during the Pride Parade, and do chalk figures around us during the call for treatment. That was when treatment still wasn't covered, and still isn't, you know, as you mentioned, Deanna. And the going to the World AIDS Day conference in 1996, when they announced the cocktail, that was a huge watershed moment. People were crying. There was people in wheelchairs. I remember a friend and I from Guelph, we helped people, you know, go to these events that were sponsored by pharmaceutical companies. And the tears were like, some people didn't make, including my own partner, didn't make it that long. They died just before that watershed time of 96. And had they lived, literally their lives would have been saved overnight, because that's how quickly and how powerful the treatment was. So that was a very bittersweet time too, but to be part of that community when that happened, that's something I'll never forget as well. So just two more things to to add to the memories in relation to like long-term survivors too.
Thank you, Tim. Another question that we've got coming in right now is about the specific challenges that are, now this is bringing it from a past to a present timeframe, but the specific challenges experienced by people living with HIV related to COVID-19 and what we're going through right now. Would anybody like to speak to sort of the challenges that long-term survivors might be facing? I know, Deanna, you have been mentioning the parallels in your talk.
I'm happy to jump on. Kelly, you may have a better perspective because you're a person living with HIV. And so I would completely respect your opinion more than mine. But what I'm hearing from patients is there's some trauma being triggered from all of this, and watching others go through it, and the fear of the unknown again, of how is this transmitted. We certainly have some information, but we don't have all the information. We don't have a treatment. Or we're trying new treatments, but we don't actually have something. We don't have a vaccine. And so this is triggering trauma for a lot of folks. I'm hearing folks who are struggling again with mental health, with depression, because not only have we all been in lockdown and been in our homes where they are feeling quite isolated and alone, but now dealing with this uncertainty all over again. And watching, you know, our world's not in a great state right now. You may have noticed, and there's a lot of fear, there's a lot of violence, there's a lot of uncertainty, and I think it's affecting everyone.
Yeah.
Can I cut in for a second?
Certainly.
Now, living with HIV and this pandemic going on, it almost, like, I wasn't here. Well, I was alive in the 80s, but I wasn't around people that had HIV then, really. So with doing my TTOA, my PLDI training, I watched the video of the AIDS epidemic back in the 80s. And for me right now with this pandemic, it's making me feel like I'm in the 80s sometimes, because you got people that are doing this, tucking away, and it is very bothersome. And, you know, being someone like myself who always likes being out there and a go body and, wanting to make a difference in the world, it's hard to do when you're cooped up in a house because of this pandemic that's going on. And so it does get to your mentalness. But for me, I just keep looking at it this way. If I beat my crack addiction, I'm fighting my HIV to the like no tomorrow, I'm going to continue to fight the pandemic as well. So I really hope that we can get through this, and all the other patients out there too, and make it through this pandemic, because we need to. We can't just allow this to take us. And, so it is very important that we at least try to be there for the other one that is having a hard time with this. I live with depression and high anxiety and low stress tolerance as well. And it does take a toll sometimes, but when I look at reality and look at life, this is going to pass. It's taken longer than what we originally hoped it would, but it will pass. And I can't wait till I can get back out there and get this bigger on the way it was supposed to be this year.
Thank you, Kelly. And thank you for highlighting the resilience of people living with HIV, especially in this context. It's long-term survivors have survived through so much and have flourished in situations that really have done nothing but bring them down. And the opportunity that you propose to us of your own resilience and of having resilience in these situations is beautiful.
Thank you, Matthew.
There's another question that's come in, and I'd actually sort of like to relate it to this question. So I'm just going to be answering two questions at once, sort of. So please bear with me. The question is, can I ask what type of support programs ARCH has for long-term survivors? So,
Yeah.
sorry.
No, go ahead. That's on you. You can answer this one.
So as Arch's support services coordinator, and I also luckily have our clinic coordinator with us as well, and our practical support worker. So we've got a whole team of folks here at the moment who really can answer this question. But first, I'd like to bring that into the context of COVID-19. A lot of our programming that we run is usually in person or in our office, or even out in the community. If I were to visit somebody in their house, there's a lot of situations right now that we can't do what we regularly do, but it also provides unique needs for people who are in our catchment and for people who we do support. If that is social isolation, we do place calls and we try and get in contact with people. If we can't reach them directly at first, then Deanna is absolutely incredible and will get in contact with people when she can, or let us know, just like, hey, because I was able to come into the office today, this person left you a message and this person needs this. And we are going to work as a team to make sure that we're still supporting people.
That we are.
Now, we also are helping people when, in terms of food security, organizing hampers to deliver out to our community members who are having difficulty with food security. So those are two of the main initiatives that are happening right now. And some of our other work still continues. So when it comes to somebody having trouble with medication access, that is still something that we are going to help out with. That's still something that, like, if we need to try and make sure that you are able to get onto the Trillium drug program, or make sure that your work actually is covering it through their insurance because it says it does, but then when you're talking to the insurance person, things are just getting confused, we can do that advocacy still. Regularly, we do help out with transportation to and from important medical appointments. That's something that's difficult and we're not really able to do right now in the same capacities that we were able to do before. So we might be able to find assistance through ODSP to get you a cab to somewhere that you need to go, but a lot of it is a lot of workarounds right now. And I'm sure that's something that Tim is experiencing in his region as well. But our support and our commitment to long-term survivors has not changed, and to people living with HIV in general. I know that Deanna, who is ready to speak, is still raring to go. So actually, I'd like to first pass it off to Deanna and then to Tim to be able to talk about his region.
Yeah, so I just wanted to jump in. Of course, we have support here and programming for everyone living with HIV and those who are also affected by HIV. So if you have a family member or friend who needs support, we are here for you for that also. But something that is quite different in my work for long-term survivors in particular is we're now having to look at some of our folks are maybe going to start transitioning into retirement homes and long-term care. And this has never been a thing. We haven't had folks old enough to get there. So I have been going into long-term cares and doing education with the staff on what that means to have a resident in their homes who has HIV, to make sure that there is not stigma within the staff or the culture of the facility, so that the staff understands what the needs of those residents will be. And that's not something we ever had to do before. We're also constantly learning about new medications that will help our folks all become long-term survivors. So the one thing I forgot to mention before is the newest medications that are coming out are injectables. And I'm super excited about these medications because what it will mean is our folks will pop in here once a month to get an injection and they won't have to take any pills. So there is one injectable medication out already, and we're hoping to start some folks on that. But what the greatest part of that is once a month, when you take your medication in an injection, you'll be reminded of HIV, and not 30 days a month when you have to take your pills. So those are some of the things on the clinic side. Certainly, we're also looking at protecting our folks during COVID. We've moved our events to online. So there's, I think, Mindy, you have a great online talk for folks living with HIV. We've got masks out to all of our are folks here who are clients or patients. And if you haven't got one yet, send me an email because I'll make sure that you get that.
I got lots of masks too, eh? I should bring some in for you, Deanna.
Okay, Cal.
And Tim?
Yeah, sure. So in terms of programming for long-term survivors, so in our region, so we have basically 3 different regions. So some of the programs are tailored to what is going on in the region and what people want, really. So we're always asking input for the kinds of things they want. So whether it's Hamilton or Brantford or Halton, really just depending on what people might want to do. So we've had lots of social activities, to deal with people with social isolation, which is ironic right now has been interrupted by COVID. So we've had a lot of those kinds of programs over the years, and more recently, I guess, really, I would point to like our PHA leadership programming has come back in a different form. It's been there in a lot of different forms over the years, but now with an advisory committee and support from PLDI and the other great provincial programs we have, and colleagues here like in Guelph and across the province involved with those as well too. So we really try to tailor it to what people want. Right now it is very difficult with people, everybody basically being in self-isolation. And what I wanted to say before too about, I appreciate people with HIV really appreciate and understand the need to do that right now and to be mindful of that. Because they recall that time when there was much more fear about how HIV and AIDS might be transmitted. So having that memory, I think, really serves well for the respect they have for the conditions that we all have to live with right now. So we're trying to do things like this. This is an online support, telephone support, obviously, right now. We just introduced, we got a new food partnership to do deliveries of groceries to about a dozen clients every week, fresh stuff. So that's a nice partnership just to add to what people might need for food security. We've had a lot of recreational programming too, but I think we're going to be, I think there's going to be a lot of anxiousness for people to get back to do something, but it's going to be a while, I think. So we're probably going to have to do and continue to develop more online program like this one is an excellent example.
Thank you, Tim. It sounds like you're really doing a broad range of services right now, and I certainly understand the need. And I think you raise an excellent point in you are serving many different communities, as so many ASOs have large catchment areas that are not a monolith. Our catchment areas really are different than one city over is different, and their needs are going to be different. And we really do need to be providing stuff based on what each individual needs and what each region needs. Thank you for that. That's actually the ending of our Q&A period right now. Thank you all for participating so much. Before I hand it off to Mindy for some closing words, I'd first like to talk about a new project that Arch is trying to get off the ground right now. So one thing that we would really love is to have the ability to share stories. This program is called the AIDS Memorial Project. And although the focus and hope will be to be able to share the stories of those that we have lost to HIV and AIDS this coming AIDS Awareness Week, that's the last week of November, leading into the AIDS Vigil on World AIDS Day, that's December 1st. We would love to gather stories of people who have passed on from HIV. However, in the spirit of Long-Term Survivors Day, we also would love to have stories of surviving with HIV and of thriving with HIV and what people's lives are right now living with HIV. No story is something that we are going to turn away. And if we could honor and share those stories for you, that would be a wonderful experience for us. If you'd like to hear more about the project, please check out our social media. There are posts about this on our Instagram and on our Facebook. You can also contact Mindy Brown, our practical support worker, who I'll be turning it off to in a second. And that's at practicalsupport@archguelph.ca. That's practical support, all one word, at archguelph.ca. And that's where you can also submit stories or ask further questions about this project. Thank you so much. And now to our wonderful practical support worker, Mindy.
Hi. I just want to thank our speakers, Kelly Timbers, Deanna Clatworthy, and Tim McClement for speaking today and sharing with us. Long-Term Survivors Day gives us the opportunity to spotlight the unique role of HIV long-term survivors in the AIDS epidemic and to raise awareness about the challenges and resilience of the individuals who are on the front lines of the early epidemic. Thank you to everyone who has joined virtually to share this day with us. One day together, hopefully, we can see the end of the stigma surrounding HIV and AIDS.
Thank you,
Thank you.
Mindy.
Thank you.
Thank you.
Thank you, everybody.